So we have 3 drugs that all were tested in roughly third or later line HER2 positive metastatic breast cancer. All of them show encouraging levels of activity. I think pretty dramatic improvements with tucatinib. The data with trastuzumab deruxtecan look very impressive in terms of efficacy. So I think these are all things that may have a good chance of improving outcomes substantially for patients with HER2 positive metastatic disease. There are other drugs being tested. Neratinib is another kinase inhibitor I mentioned earlier. It's an irreversible kinase inhibitor of both HER2 and EGFR. It was tested in the NALIS trial that was presented at ASCO. That was a trial that compared patients who had pretreated HER2 positive disease, received either a standard of capecitabine lapatinib or capecitabine and neratinib. And in that study, the neratinib did show an improvement in progression-free survival and higher response rates compared to lapatinib-based therapy. As was expected, it also showed more diarrhea. Again, neratinib is a very potent inhibitor, so along with increased efficacy, it also seems to have increased toxicity. This toxicity generally is manageable with aggressive use of prophylactic antidiarrheals, but it's definitely something that needs to be thought about when using that drug. In addition, there's a number of other agents being tested in earlier lines of phase of trials. Drugs in phase 1 development that we can talk about in the future. One other agent that's in clinical development right now is another antibody drug conjugate targeting HER2. This is what's called SYD985. This uses yet another type of cytotoxic payload along with a HER2-directed antibody. This agent has been tested in pretreated HER2-positive breast cancer in a phase 1 study that reported encouraging levels of activity with response rates in the 30 to 40% range. This is interesting in that it also seems to be able to be active in HER2-low expressing cancers. It has an interesting side effect profile in that ocular toxicity seems to be a problem in a substantial fraction of patients, so this is something that's going to have to be managed. But the activity does look encouraging in patients who've already had progression on other agents. SYD985 is currently being tested in a phase 3 trial called the TULIP study, which is randomizing patients with HER2-positive advanced breast cancer to either this new antibody-drug conjugate or a standard of care regimen. As we've discussed, the introduction of HER2-directed therapies has clearly improved the outcomes for patients with HER2-positive metastatic breast cancer. We have dual blockade of trastuzumab and pertuzumab chemotherapy in the first line, T-DM1 in the second line, and a number of combinations of HER2-directed therapies and chemo in third and later lines of therapy. I think what's going to change dramatically in the next year or so is the introduction of these newer agents that we discussed, like tucatinib, like trastuzumab deruxtecan, margetuximab, and additional agents. This is undoubtedly going to further improve outcomes for HER2-positive patients. I think it's going to require the oncology community to learn how to sequence these different drugs. They have different toxicity profiles, different mechanism of action, and how we use these interactively is going to take some work. And certainly I think we're going to need to learn how to personalize them for individual patients, since presumably some patients are going to benefit more from one versus another. But I think overall this is very good news for patients with HER2-positive metastatic disease, and I think we're all encouraged by the results that have come out this year in 2019.